And today I'm very excited to be hosting this webinar with a great panel of guests that we have today for our listeners. We have Professor Javed Iqbal, we have Dr. Sahel joining us all the way from London, Irfan, and Dr. Shiraz. So Professor Javed Iqbal doesn't need any introduction. He's a general surgeon and a healthcare consultant with 35 years of experience in general surgery. He's the ex-director and DME of Qaid-e-Azam Medical College. Dr. Suhail Chuptai, who joins us from the UK, is a consultant orthopedic surgeon based in London. He's a chief technology officer for THP Global UAE and telehealth and AI strategist for over 10 years. Then we have Dr. Shiraz Nasir, who is head of AI department of Xeven Solutions. He has a PhD in AI and data science with over 20 years of experience. And finally, we have Mr. Irfan Malik, who is the founder and CEO of Xeven Solutions, who again needs no introductions. He has a PhD in AI from LMU, and he has more than 15 years of experience of development technology. So as I welcome all the guests and I welcome all the speakers, I would like to start with a little bit of introduction about Xeven Solutions. As we know that Xeven Solution is a technology leader, has been for many, many years. We as a team, I am also a director of Xeven Solutions. We have Irfan Malik here, who is a founder and CEO of Xeven Solutions. Professor Javed Iqbal, Dr. Suhail Chuptai, and Dr. Shiraz, we all work together in Xeven Solutions under health technology. And a little bit about Xeven Solutions. Xeven Solution is an innovative health technology enterprise which has over 200 skilled engineers. We help companies create artificial intelligence, machine learning driven solutions. Our AI engineers are leveraging cutting edge innovations and technology to develop solutions which are not only applicable in healthcare, but they actually understand how complex is healthcare, and we build solutions so that care teams, physicians are able to implement them easily in their healthcare setting. We have developed a range of health tech solutions ranging from end-to-end EMR solutions, comprehensive HMIS solutions, telemedicine solutions, AI-driven solutions for healthcare, pharmacy platforms for many, many clients all over the globe. Our presence is in Pakistan, London, US, UAE, and we are very fastly moving to other parts of the world. And we are very excited today to do this webinar where we especially talking about how artificial intelligence and how innovative technologies are reshaping or transforming the way healthcare is given and received. So before I move to the questions, I like my honorable guests to please introduce themselves very quickly. I think I will move first to Dr. Suhail, and then Mr. Irfan, Dr. Shiraz, and lastly to Professor Javed Iqbal.
Thank you very much. I appreciate your introduction and your overlay of the Xeven solution. I am an orthopedic surgeon, and for the last 20 years, I've been quite heavily involved in technology, being a Microsoft certified specialist and MIT certified AI healthcare specialist. And recently, I've been doing work for NHS in the Conservative Friends Forum. I've developed around 20 or 25 plus, in fact, telehealth software. Many of them have been acquired. And my passion is to connect doctor to the patient in such a way that we use most efficient means and we deliver the best of healthcare. And that drives me forward. So I keep doing that. Apart from my clinical practice in London, I like to express the best way the technology can help the patients. That's the way it drives me.
That's wonderful. Thank you very much, Dr. Suhail. And I would kindly move to Professor Javed Iqbal.
Yeah, thank you very much, Dr. Tazeen. I'm Javed Iqbal. I'm a surgeon with a special interest in laparoscopic surgery.
I think there is some issue with Dr. Saab's internet.
I'm sorry, I cannot. I think we'll wait for Professor Javed Iqbal to come back. We can move on to Mr. Irfan Malik.
Hello, everyone. Assalamu alaikum. My name is Irfan Malik, founder and CEO of Xeven Solutions. And Xeven Solutions is a tech company doing so much, as that Dr. Tazeen has already described, in the healthcare space particularly. And I've spent more than 15 years in 23 different technologies, and I spent 3 years in medical college as well. So I've got the information from the both worlds, the medical and the technology. And the passion is to create something in the field of healthcare sector where I see so much potential. And I strongly believe in healthcare sector, you really cannot do, as a data scientist, you cannot do anything until unless you have subject matter experts with you. So today, if you just see the team, we have got people, we have got experts from the healthcare sector, and we have got experts from the data scientists as well. The agenda is to share what is AI, what AI can do, and what we are as a company going to do to create innovation in the healthcare sector. If Dr. Javed is not back, Dr. Shiraz, you can move on.
Thank you, Irfan.
Yeah,
Dr. Yeah, we can hear you
Oh,
now.
yes, we can. Happy to have you back.
lovely.
Okay.
And I help Xeven Solution. I help Xeven Solution when they develop any softwares for the medical, for the hospitals and for any health professionals consumption. So I just help them. And so I was especially interested in artificial intelligence because I could see that, as I have read somewhere, that artificial intelligence is like a bullet train. Either you are in the train or you are not out of the train, you are on the track. So if you are in the train, you will reach at the destiny, but if you are on the track, you know what can happen. So I'm really very excited to be part of this webinar, and I'm looking forward to learn from these learned speakers. Thank you.
Thank you very much, Professor Javed, and it's such an honor to have you in the team, and we learn from you every day. And last but not the least, we move on to Dr. Shiraz. Would you be kind enough to give your brief introduction?
Thank you so much, Dr. Tazeen. So, I am Shiraz. I've done PhD in computer science with specialization in AI. And I've published more than 20 impact factor research papers for AI in healthcare. And I was fortunate enough to be included in the Stanford 2% top scientist list in 2022. And now I am leading the AI initiative at Xeven Solutions as head of artificial intelligence development. And here we are trying to connect the AI with the healthcare to deliver the best possible healthcare, which can the technology give to aggrieved patients.
Thank you, Dr. Shiraz. As we see, we have quite an illustrious group of speakers today. And as Irfan and Professor Javed also mentioned, it's so important for technology, especially in healthcare, when we're designing technology. And I'm speaking as a clinician that it's so important that clinicians are involved. Technology cannot be developed in a vacuum unless we really speak to the people who are actually using technology. We can't really make solutions which can disrupt or improve the existing or even address the existing pain points. So thank you to everyone for your introduction. We will move to our questions session. I'm going to ask questions to our panelists. So first and foremost, as the topic says, AI in healthcare, I want to ask Dr. Suhail, why is AI becoming such a transformative force in the healthcare landscape today?
This AI has become third person in the room, doctor, patient, and then this is AI, which is invisible. And it has the potential to really revolutionize the whole spectrum of AI, take from diagnostics to medical management, to therapeutics and research. I give you 5 examples, the ones I'm using in my clinical practice. When I go away from my work, I have an AI assistant, a practice manager nurse. Now, that nurse is a large language model which I designed and trained to work for my clinical practice. So that means that there is a number for the patients to call, and the patients will book their appointment through that AI assistant. And the AI assistant will give them very generic information, and as well as very specific. Like if there's a knee pain patient, she will ask, I call her virtual Jennifer. Jennifer was my first secretary when I became a consultant in the country. So I wanted to dedicate that name to her. So I designed that AI application to take history from my patients, even take the payment, and then send the history to me in the clinic. So when the patient comes to my clinic, I have a history, that what this patient has and how can I start. So that saves me a lot of time, which means that patients can make appointments to my clinic 24/7. Now imagine this advantage. Isn't that something which is very, very, very special? And with the advent of generative AI, it has become a lot easier. But because before it was a Python-based AI, like a what if scenario. But because of generative AI, it's a kind of non-structured conversation data it's trained on, which means that the natural language processing capability of generative AI can actually understand what the patient is saying, even if there's no keyword. The previous
True.
AI was based on keywords. Now this is based on the context. So that is where the conversation doesn't end abruptly. So that's one area. The second area is when patient comes to my clinic, I can go through the records of the patients. And as you know, in UK, the medical record management, there are thousands and thousands of pages sometimes, maybe up to 5,000 pages. So I want to see what's going on with the patient's knee, for example. So let's take the same patient. And I can talk to that medical set of records in a way. What do you think? Does this patient have a diabetic involvement in the past? Or what about the hypertension? Did this patient have any accident on the knee? So I can talk to the medical records rather than surfing through pages. I can extract the proper information in the kind of a paragraph. So that is my patient waiting outside before the patient comes in. I've got history in front of me, not spending time. Once I start talking to the patient, then the conversation is recorded. Now that means that we can have extractive summarization, like keywords, like diabetes, like hypertension, like fracture, or we can have abstract summarization, like the context. For example, if I say, I think you got osteoarthritis, what that means that the doctor thinks the patient has osteoarthritis, but he wants to go further. So that's the context summarization.
True.
Then if you go further, once that is done, then the whole thing can be stored back in SOAP notes, subjective assessment planning notes. All the information like diagnosis will go into diagnosis, investigation will go into investigation, and I have more time for my patient. So I don't have to put my head down or sacrifice my lunch to do some notes. I can just go home after that. So this is a huge advantage and you will use the word transformative. Yes, it will be transformative because there's less burnout. Doctors can be more empathetic to the patients rather than burying their heads in the notes. One thing I want to tell you very clearly, if you're my patient and I'm looking at the notes, I've lost the contact with you. But with no worry like this, that I know that my notes will be summarized, I can keep looking at my patient. I have more eye contact time. And that is the advantage. That is what AI has done for us. It has connected doctor and patient.
Absolutely. And as you said, it has so many immense potential. It can truly change a lot of stages of a care continuum of a patient journey. And it's especially in diagnosis, as you say, it can truly be transformative. If I move this question to Professor Javed Iqbal, how in your experience have you seen the transformative power of AI in the clinical settings?
Dr. you're mute.
Professor, you're mute.
Thank you very much. See, after listening, Dr. Suhail, I'll be addressing more to the doctors who are working in Pakistan or in those areas.
Sorry to interrupt you, Dr. I think I'm receiving so many messages here. We can keep it in bilingual.
Oh, okay, no problem.
Oh, okay.
Okay, that is all right. Okay, fine. I mean, there will be some of my audiences may not be understanding English. देखिए, मैं खास तौर पर बात करना चाहता हूँ अपने उन दोस्तों के साथ जो पाकिस्तान से हमारे साथ ज्वाइन कर रहे हैं. जब आप डॉक्टर सुहेल की बात सब सुन रहे थे, तो आपको शायद ये लगा हो कि ये जो AI और जितनी टेक्निकल बातें हो रही हैं ना, ये शायद अमेरिका और बर्तानिया के लिए हो रही हैं, जहाँ के सारा ये सिस्टम है. लेकिन मैं अपने 35-40 साल के तजुर्बे के साथ आपको बताना चाहता हूँ कि ये सब कुछ दुनिया में किसी जगह पर भी मुमकिन है. अगर हमें इस माइंडसेट के साथ ये समझ में आ जाए कि हमारा एक पेशेंट जो मेरे पास पेन राइट इलिक फोसा के साथ आया है और जिसको मैंने अपेंडिसाइटिस डायग्नोज करके अपेंडिसेक्टमी की है, वो एक बिट ऑफ इंफॉर्मेशन है जो कि पूरी इंसानियत के फायदे के लिए इस्तेमाल हो सकती है अगर मेरे पास डाटा को इकट्ठा करके उस डाटाबेस की बुनियाद पर उससे आर्टिफिशियल इंटेलिजेंस के जरिए से कंक्लूजन ड्रॉ करने का सिस्टम डेवलप हो जाए तो आप यकीन कीजिए कि हमारा एक एक पेशेंट इज एक्चुअली पार्ट ऑफ दैट जिक्सा पजल, जिससे हम पूरी दुनिया के हेल्थ केयर के प्रॉब्लम को सॉल्व कर सकते हैं. सो इन माय पर्सनल ओपिनियन, this humanity has so many landmarks which have changed the course of the humanity. लेकिन आर्टिफिशियल इंटेलिजेंस उन सब से मुख्तलिफ है. जब पहली दफा आग को डोमेस्टिकेट किया गया था तो पता लगा था कि दुनिया चेंज हो गई. जब पहले व्हील इजाद हुआ था तो पता लगा दुनिया चेंज हो गई. फिर जब इलेक्ट्रिसिटी इजाद हुई, कंप्यूटर इजाद हुआ. लेकिन आर्टिफिशियल इंटेलिजेंस और बाकी तमाम लैंडमार्क्स में ये फर्क है कि बाकी सब में इंसान सेंटर में था, मगर आर्टिफिशियल इंटेलिजेंस वो नई इन्वेंशन और नया टूल है जो कि खुद कैपेबल है डिसीजन मेकिंग करके और इंसान से ज्यादा कंप्यूटिंग पावर के साथ और कॉम्प्लेक्स कंप्यूटिंग पावर के साथ हमें सॉल्यूशन दे सकती है. लिहाजा मैं अपने जाती तजुर्बे की बुनियाद पर आपको ये बताना चाहता हूं कि जो हमारे दिल में एक फियर था ना कि शायद आर्टिफिशियल इंटेलिजेंस इज गोइंग टू रिप्लेस द ह्यूमन बीइंग्स, is going to replace the human being, this fear is wrong. It is only going to replace those people who actually don't know what artificial intelligence is. When we learn artificial intelligence, then this is our synergy. It will increase, as Dr. Suhail has given so many beautiful examples, that it will create a synergy to us and it will enhance our potential to help our patients. And moreover, when we are working with under the domain of artificial intelligence, we become a kind of a global citizen. Whatever we are doing actually is going to impact on the healthcare of the whole planet. So I know I am, out of all of this panel, I am the one who knows least about the technical part of it. So this is why I will not talk much, and I would like other speakers to please speak so that our audience can be benefited more. Thank you.
Thank you so much, Professor. And whatever you say is absolutely true. I think more and more doctors, clinicians like yourself, like Dr. Sahil, we all need to understand that technology is not replacing doctors and care teams. It is here to help us do better. Technology, AI is just another form of technology, is in the end, is just a tool that has the potential to improve the way we work, and especially the potential of AI to work on the data that is not humanly possible for us is amazing. The what it can do for population health, for population trends, for data analytics is something that a human mind is capable of, but it can take us hours to do something that an AI could take seconds. And that is why we really need to understand that AI, like any other technology, is a tool. It will not replace doctors. It cannot replace care teams, but it can surely change the way we work. It can make our hospitals more efficient. It can make our clinical settings more safer and better if we use them in the right places. So as we're now talking about technology and we've used words like artificial intelligence, data-driven technologies, I think it's we should ask our technologists here, our technology experts, why AI, apart from so many other innovative technologies, why AI today is so disruptive, not only in healthcare, but in general. I think the audience will be able to learn what is in AI that it makes it so disruptive. So Irfan, if you can ask, Irfan, if you could please tell us why AI is so disruptive.
See, thank you very much, Dr. Tazeen. You have used one word, which is data. And without AI, we were not getting any benefit out of the data. And particularly when I started this company, I figured that in healthcare, particularly in healthcare, data is going to be a gold mine, although data is a next oil, but data in healthcare sector is very important. And what AI is doing, actually utilizing that data very, very smartly with no intention to replace any human being. Since data is everywhere and there is a limitation, human mind is limited to process the data, store the data, but machine is almost unlimited to process the data, store the data, extract patterns out of the data. Machine can really see what human cannot. So when we are talking about patient, when we're talking about healthcare, we need to see in detail. AI can see it in detail that human for now cannot imagine. So this is the first entry where AI creating so much disruption. And then after the evolution of these large language models recently, since there was so much data sitting out there, and now we have large language models, so there are so many things that AI can achieve when we are talking about diagnostic medicines or even many other disciplines in the healthcare sector. But once again, it is not about replacing any human. It is about extracting more patterns. It is about extracting more information out of the data is there. This is a one important factor. And then when we're talking about disruption, we need to understand the fact that implementing any AI model in anywhere, in any field of life is not that difficult. The difficult part is to identify where we are going to implement it and what we are going to implement. What are the problems that AI can really address? What are the patterns? What are the data indicators that we can extract out of the data? So to do that part, the challenge is there are people who really don't understand that how to implement, what to implement, and then comes how to use it. So obviously AI is coming like a bullet train. So if somebody is not understanding it, somebody is not developing that understanding, then definitely someone with that knowledge is going to replace that person, going to create little gap. So this is the one reason why we have started this awareness series, so that we could develop awareness, we could develop that basic understanding of the AI, the critical thinking, because innovation cannot come up without the information. So to know the real power of AI, we need to understand the real power of AI to understand the cause of disruption. And disruption can be positive, can be negative. To avoid the negative side of disruption, awareness is very, very important for all of them. Dr. Shiraz is with us. Dr. Shiraz, we were talking about the same factor before the call, and Dr. Shiraz was talking about some tools and some other technical perspective of that segment. If we can move on, Dr. Shiraz, with the same question.
Yeah, sure. Thank you so much. And I will be going bilingual, और हमारी जो audience है local, उनको भी address करूँगा मैं. इस क्वेश्चन का आंसर देने के लिए इरफान, I would borrow some words from respected Dr. Javed Iqbal, and I would respectfully borrow some thoughts from you as well. डॉक्टर साहब ने कुछ टेक्नोलॉजीज के नाम लिए जो बहुत डिसरप्टिव थी, जैसे अब उसमें से क्लोजेस्ट जो मेरे माइंड में आती है वो इलेक्ट्रिसिटी है. तो अगर आपने देखना है कि ये डिसरप्टिव क्यों है, आप देखें कि इलेक्ट्रिसिटी से पहले की दुनिया क्या थी और इलेक्ट्रिसिटी के बाद की दुनिया क्या है. So you would see a major shift. Similarly, जब हम AI की बात करते हैं, तो आप एक सिंपल एग्जांपल है, आज से 1.5 साल पहले की दुनिया देख लें और 1.5 साल बाद की दुनिया देख लें. So there is a major difference. और सिर्फ ये तो बहुत छोटी सी एग्जांपल है. अब ये टेक्नोलॉजी डिसरप्टिव क्यों है? इसलिए कि इससे जो पॉसिबिलिटीज क्रिएट होती हैं वो अमेजिंग है. फॉर एग्जांपल, आप एक स्टूडेंट हैं और आप एक मुश्किल कॉन्सेप्ट पढ़ रहे हैं, लेकिन आपको कोई समझाने वाला नहीं. आज से 1.5 साल पहले तो कोई नहीं. बट नाउ सडनली हर स्टूडेंट के पास एक टीचर मौजूद है जो इंडिविजुअली उसके हर क्वेश्चन का आंसर कर सकता है. आप एक डॉक्टर हैं, आपने एक पेशेंट देखा, आपको एक सेकंड ओपिनियन चाहिए कि मैं इसका डायग्नोज जो बना रहा हूं, इसके लिए जो मेडिसिन मैं दे रहा हूं, क्या इसके अलावा कोई और मेडिसिन भी इसके लिए बेहतर हो सकती है, या कोई और डायग्नोज का कोई पैटर्न भी हो सकता है. सडनली आपके पास सेकंड ओपिनियन के लिए एक टेक्नोलॉजी है जो ना सिर्फ आपको आइडिया देगी, बल्कि कुछ ऐसी बातें भी याद करा देगी जो शायद आपका डायग्नोसिस और इम्प्रूव कर दे. सिमिलरली, अब मैं एक तीसरी एग्जांपल देता हूं और फिर आपको आइडिया हो जाएगा कि जो मैं बातें कर रहा हूं ये सिर्फ इन 3 डिसिप्लिन पे वैलिड नहीं है, ये हर पॉसिबल डिसिप्लिन पे वैलिड है. मतलब आप एक लॉयर हैं, आप एक केस प्रिपेयर कर रहे हैं, आपको ये देखना है कि यार मुझे ये केस प्रिपेयर करने के लिए कौन कौन से लॉ चाहिए. पहले आपको काफी रिसर्च करनी पड़ती थी, लेकिन अब आपके लिए एक पीयर रिसर्चर आपके फिंगर टिप्स पे मौजूद है. सो आप कोई भी डिसिप्लिन ले लें डॉक्टर ताजीन, आप कोई भी डिसिप्लिन ले लें इरफान, तो आपके पास सडनली एक एंटिटी मौजूद है जो यूनिकली आपके प्रॉब्लम्स को सॉल्व कर सकती है. And that is why AI is unique and different from all the technologies जो इससे पहले हमने सारी की देखी. So what makes AI
Absolutely.
disruptive is the possibilities it creates for each of the human being.
Yeah, that's very important. And it's such
Dr.
a great
Tazeen, if
point.
I can, Dr.
Yes,
Tazeen, excuse me.
absolutely, Dr.
I've
Shaheen.
just received
Absolutely.
I'm sorry for this interruption. I just received a message on my phone where a friend of mine who's attending this webinar said that all we are listening is very fascinating, but
Mm-hmm.
I know only word AI. What do you want me to do? Do you want me to
That's
buy
a good
a
question.
software? Do you want me to buy a software having AI? Or do you want that I should learn AI? And if I have to learn AI, then what is the first step to learn? And please give me the roadmap so that I can start learning it. So
I
on
can
behalf of that, I thought I should put this question to you and you
That's
be
a
the expert.
such
Yeah.
an excellent
I think I
question.
received such
Yes,
question on
Irfan,
my
go ahead.
as well.
Yes, please.
So this is very important, Gordon.
Very
That's the
important,
objective
yes.
of it. So see, if somebody's there who is doing practice in healthcare and they don't know anything about AI, so the first challenge is that first question is, can a doctor, a healthcare professional, can really learn the AI? If we're talking about AI learning, what exactly you have to learn? Is it coding? Is it some kind of a deployment or server configuration? What you need to learn? First of all, let me clear one very important concept that AI, learning AI, is not directly connected to the coding. AI can, you need to just get the concepts of AI, basic concepts of AI, machine learning, models, training, data. These are very basic concepts, and you don't need any technical background. I'll be telling you that, from where you can get all these concepts. But, first of all, I need to clear one part, and that is you don't have to learn the coding. So the thing is, AI is a tool, a very powerful tool. And if you really want to innovate, or maybe use it in an innovative manner, talking about the AI tool, you need to understand the basic concepts of it. And to understand the basic concepts of it, there are many things. What usually people do is that they try to switch the field. Okay, we are doing healthcare professional, and if we're facing challenges, AI is apparently very lucrative fields. Let's switch the field. You don't have to switch the field. You can bring AI to your field. You can implement AI into your fields. And to do that, the most common mistake I am seeing is that they'll go and take some technical courses. Technical courses, there are not so many technical courses that are designed keeping the healthcare professional mindset in place. So what we have to do is that there are things, we have started that training program as well, where we are transferring the concept of AI in a very basic manner, connecting it to the healthcare sector, from in all the disciplines, so that how you can really grab it. There are certain articles, topics on the internet as well that can give you that basic understanding. Do not step over the line. Do not get into the neural networks. Do not get into the math. Do not get into the coding. Once you develop that basic concept, the second step is to explore the new tools. Whatever you are doing in healthcare, there are tools that are there to help you. If you're going to learn it, you can use it. If you don't learn and don't use it, somebody will learn and use it to increase their productivity. For that purpose, you may have to do some research. You have to explore some different tools. But let me clear a very important point. People are jumping straight to the tools without the basic concepts, without the basic understanding, without that picture in mind. Even if you're using tools, you won't be able to use it effectively. So the first step is to learn the basics. And to do the basics, we have a session that we're going to launch. There are different sessions who will be, covering all the different aspects. And then coming to the tool, and then come to the implementation. When we are talking about implementation, let me tell you, there is a huge challenge out there. In any healthcare sector, when you are going to implement the AI or any model, or even a chatbot, there are adaptability challenges. Most of the people feel like AI is going to replace them. Some of them are, are not willing to grab it. There are multiple challenges. There are training problems. You cannot, leverage the AI in any institute, even in clinic, if you don't train your staff, if you don't tell them the basic purpose, the basic use, the basic concepts of AI, so that they could leverage it. So step one is to grab the basic concept. I've just shared that how you can do that. Step two is to explore the tools. Step three is to start the implementation. This is a huge subject. It's going to take few weeks, at least 7 weeks program that we designed, that how you can from basic to the advanced, not advanced in terms of coding, not advanced in terms of math, advanced in terms of larger application of AI in healthcare sector. So that's a little, roadmap I've explained. I hope that
that's very true. So in fact, I will just go one step above, like what Professor Javed said was a very pertinent question and how Irfan explained. I believe today where we are, every clinician, every care team, every stakeholder along the care continuum, when we talk about the patient journey, they don't not only see the doctors, they talk to the pharmacists, they talk to the paramedics, they talk to the admin staff, they talk to the accounts. All of them need to have understanding of AI. Just buying an AI tool or just buying an AI system is not the answer, because until every person understand the value that the AI tool can do in their surroundings, they won't be able to make use of it. And I have years of experience of implementation where clients have bought these expensive EMR solutions, chatbots, data-driven technology, but the end user is unable to use them because A, they don't understand it, B, they don't think it's any good to them. So it's very important that when you are trying to learn, understand what AI can do for you in your clinical setting, because
Doctor,
healthcare is
like
complex.
one big thing. Basically, it's a question with the previous part. It's been many years, and we have been developing so much in this particular field. Let me just share my experience with all the healthcare professionals. Degree in this particular field, degree won't help. What will help is that exposure, information, exposure, and application. There's a concept, you don't have to spend years into it. A few weeks, a few dedicated, well-planned week can give you that exposure. And basically, and let me say that we, as a healthcare AI software developer, we cannot innovate a lot. As I said in my introduction, we cannot innovate a lot, if we are not receiving so many ideas, if we are not getting so many ideas from the healthcare professionals. And to generate those ideas, we need to develop critical thinking. And to develop critical thinking, you need to research and explore and apply. It's a cycle. Degree won't help. I don't see any degree which is particularly designed for this purpose and takes years to do that. I believe in few weeks, in few dedicated weeks, systematically, you can achieve what degree can give you in a year or two.
No, absolutely. That's what I say. It's so important for people to understand what it can actually do. Only then you can take the first step and say, you know what, I need this tool and this is what I will do with it. Were you trying to say something, Dr. Sahil?
No, I'm just trying to be, I just want to say one thing about data. In 1950s, it took 50 years to double the medical data before that. In 2020, it was just 3 years to double the data. And currently, it will take only 73 years to double the medical data. So जब इतना ज्यादा डेटा रेप्लिकेट हो रहा है और अवेलेबल हो रहा है हमारे पास, तो हमारे पास कोई तो सिस्टम होना चाहिए कि हम उसको मैनेज कर सकें,
Absolutely.
हम उसको फायदा उठा सकें. और अगर हमारे पास कोई ऐसा सिस्टम नहीं है, देखिए ह्यूमन एरर्स बहुत होती हैं. अगर आप एक बंदे को बिठा दें कि आपने एक सैंपल पेशेंट 100 सैंपल पेशेंट ढूंढे ड्रग डेवलपमेंट के लिए, अब दैट कैन टेक years and years. It takes 24 hours or less for AI system. अब ये आपको बात बड़ी अफसानवी लगती है कि कहाँ 1 साल और कहाँ 1 रात, ये बात ऐसा ही है. And that is how this system is revolving and evolving in the whole profession around. देखिए, जब आप डेटा कॉम्प्लेक्सिटी की बात करती है ना, तो AI smiles at it. It doesn't worry because that loves it. It eats data complexity for breakfast. तो जब इसके अलावा एक और चीज है, तो एआई में एक खास बात यह है कि एआई इज इमोशनलेस, और खासकर जो जनरेटिव एआई है, इसको हम ट्रेन कर सकते हैं, लेकिन वी कैन स्टिल कंट्रोल इट, वी कैन स्टिल कंट्रोल व्हाट वी फीड, व्हाट कैन गेट्स आउट ऑफ इट, अनलेस कि आप उसको सेल्फ अडेप्टिव एल्गोरिथम पे ले जाएं, जिसकी बात कभी हम बाद में करेंगे। लेकिन दिस इज द होल फैसिनेटिंग वर्ड, जिसके अंदर आई डोंट सी एन एंड। मुझे 25 साल हो गए कंप्यूटर करते हुए, बट विद एआई एवरी मॉर्निंग आई फील आज कुछ नया है, ट्रस्ट मी।
Absolutely. And we are moving so
Completely
fast. And just
understandable.
another stat, as you were talking about data, which is quite astonishing as well. Healthcare produces 30% of all the data produced in the world today. And we don't even use 1% of that data. So imagine if we were using all the data that healthcare institutions are producing, we would be a
Yeah,
very healthy society, a very healthy population.
absolutely,
So when we
So,
are
absolutely.
talking
yeah.
about the data, there are certain challenges, there are certain risks, there are certain, problems that we are facing at the moment. And I need to share something very important is that what healthcare professionals are seeing currently as a tool, as an advancement, I can say 90% of the products out there in the market, when I say product, I say tools, 90% of them are not perfect, are not, production ready, but they're there. But what is happening at the back? We are doing research on a daily basis, day and night, that what is happening, what is coming. What is coming is truly unbelievable. It's truly unbelievable. We, honestly speaking, an average person who's not doing research in the field of AI is you can see hardly 5% of it, 10% of it. But what is coming, which is, you can say 95%, 90%, to 95% state, this is going to be a true disruption. From remote surgeries to diagnostic. There are so many things happening, So what we have to do, we have to be prepared. And to prepare ourselves, awareness is the key factor. I think anyone is, part of this stream today knows the importance of AI. The question is how to learn, how to implement, where to start, what are the tools coming, what are the effective tools, how to implement it, where to implement it. These are the questions that we are going to answer. If we cannot cover it in like next 60 minutes, definitely we're going to cover it soon. This is a series of webinars, as well as we are going to start the training sessions real soon, and we'll be taking input from you. But yes, I can safely say that we can only see 5% of it. There are certain tools that are being developed.
एक बात
Legal restrictions, people cannot disclose them. Yes, Dr. Sir.
Please go ahead, Dr. Smith.
हाँ सर, इरफान, एक बात छोटी सी आपकी बात को ही बढ़ाते हुए, कि अभी आपने कहा कि आपको डिग्री लेने की जरूरत नहीं है एआई में। मेरे ख्याल में ये बात बड़ी इंपॉर्टेंट है लोगों के लिए समझना, इसकी बात के पीछे बैकग्राउंड क्या है। देखिए, अगर आपने टेक्नोलॉजी को लीड करना है, तो आपको अपने प्रोफेशन के अंदर मास्टरी चाहिए कि कहाँ कहाँ आपके प्रोफेशन में प्रॉब्लम एरियाज हैं। आपको एआई का नॉलेज नहीं चाहिए, हाँ आपको ये चाहिए कि एआई आपके लिए क्या कर सकता है। उसके लिए बहुत अच्छी एजुकेशन है। एक तो इंशाल्लाह जो हम लोग यहाँ पे शुरू करने वाले हैं बाय अगस्त, दैट विल बी 7 कोर्सेज बेस्ड ऑन लीडरशिप इन एआई। लेकिन उसके अलावा और वर्ल्ड वाइड कोर्सेज भी हैं। तो बेसिकली आपको एआई का टेक्निकल नॉलेज नहीं चाहिए टू लीड एन एआई टीम। आपको अपनी डोमेन का नॉलेज चाहिए कि मुझे कहाँ प्रॉब्लम है। और ये बात मुझे समझना बहुत जरूरी है। देखिए, अगर आपके हाथ में फेरारी है, आपको फेरारी चलानी नहीं आती, दैट फेरारी इज यूजलेस। लेकिन आपको फेरारी का इंजन खोल के तो क्या लगा हुआ है। आई होप I'm
Yeah,
use this
that's very
analogy to
true. That's
help
why I
people
keep
understand
telling
me.
the doctors, and I work between doctors and technologists, and I've been working for years. I mean, what a problem a doctor faces or a patient faces is always the starting point of a true idea that AI can support. So you don't really need to know how to code. You don't really need to know the
Yeah,
algorithms that go at the back end. What you need is you need to know what is your issue right now and where do you want to be. And then you can lead a team of technologists that can look at your vision and then help you reach that goal. So, I mean, I know we all are talking about how amazing artificial intelligence is and all the other innovative technologies that come under AI, like generative AI. But why, where do all of you think, I'll throw this question to all my panelists, why do we still see challenges and barriers to the widespread adoption of AI in the healthcare landscape today?
Let's
देखिए Tazeen, sorry,
let's
Irfan, may I address this
yeah,
from the healthcare
please keep
perspective?
going, Dr. Sohail. Yeah, I'm
Thank
saying
you.
that
बहुत
please keep
शुक्रिया. I just want to briefly sum this answer up by saying that पहला क्वेश्चन है ट्रस्ट का, एक्सप्लेनेबिलिटी, कि ये आंसर अगर एआई ने आपको दिया है तो ये क्यों दिया है. ये बड़ा इंपॉर्टेंट पॉइंट है. इसके ऊपर यहाँ पे इंग्लैंड में हम लोग अक्सर सेमिनार्स करते हैं कि व्हाट इज द सोल्यूशन. कि एआई एक ब्लैक बॉक्स की तरह है कि इसमें से निकल रहा है, आपको ये नहीं पता कि इसकी बैकग्राउंड क्या है. अभी एक नया एआई आ रहा है, दैट इज एआई एक्स, explainable AI, which means that you will get the answer and you will get the reason why this answer has come up with this. So that is very important and that will build the trust of the doctor. दूसरा मसला क्या है कि डॉक्टर्स ये समझते हैं कि इससे मैं रिप्लेस हो जाऊंगा और वो इसको अननोइंगली रेजिस्ट कर रहे हैं इसकी प्रोग्रेशन को. अब इसके अंदर एक बात बड़ी अच्छी बात है जानने वाली कि इनफैक्ट एआई के आने से डॉक्टर्स की जॉब बढ़ेंगी और इसके ऊपर हम एक पूरा सेमिनार कर सकते हैं कि ये कैसे होगा.
Absolutely, yes.
Yeah.
इसके लिए एक छोटी सी मिसाल देता हूँ कि बिकॉज नाउ इमेजरी डेटा इज अवेलेबल, इट्स नॉट इन द वेटिंग क्यू एनी मोर. अगर एक्सरे स्कैन अगर वो 6 दिन वेट कर रहे हैं, नाउ दे डोंट हैव टू वेट फॉर 6 days, दे कैन बी सीन देयर एंड देन. सो यू नीड मोर पीपल टू एक्चुअली फाइनली साइन ऑफ द रिपोर्ट्स. एआई तो रिपोर्ट साइन ऑफ नहीं करेगा, आपको रेडियोलॉजिस्ट नहीं करनी है. एंड डॉक्टर जावेद इकबाल जानते हैं, प्रोफेसर जावेद इकबाल, कि कितना इंपॉर्टेंट है एक ह्यूमन की रिस्पॉन्सिबिलिटी लेना. पेशेंट डॉक्टर कंप्यूटर पर सू नहीं कर सकता, लेकिन वो डॉक्टर को कंप्लेन कर सकता. तो मेरे ख्याल ये बहुत बड़ा चैलेंज है, इसको एड्रेस
और
करना चाहिए पहले.
मैं ऑन बिहाफ ऑफ, क्योंकि मैंने एफर्ट्स सीएस इंग्लैंड से किया था और ऑस्ट्रेलिया से भी एक फेलोशिप की है, लेकिन मेरा चूंकि ज्यादा प्रैक्टिस का पाकिस्तान में वक्त गुजरा है, तो मेरे ख्याल में डॉक्टर तज़ीन आपके सवाल के जवाब में आई कैन सी दैट most of us are in a kind of a status quo situation. Those who can adopt it, those who have got resources, who are in the senior positions, they are in a status quo situation. They are in a comfort zone, and they think that काम तो बिल्कुल चल ही रहा है, सारा दिन मरीज भी आ रहे हैं, प्रैक्टिस भी हो रही है, तो क्या जरूरत है ऐसा करने की. तो लेकिन यही वो एक बैरियर है, आई थिंक इट्स अ मेंटल बैरियर, कि वी हैव टू ओवरकम दैट बैरियर, बिकॉज नाउ आई सी दैट a person working anywhere on the globe is a global person. तो कम से कम जो हमारे दोस्त पाकिस्तान में हैं या उन मुल्कों से बैठे हुए हैं, from those countries which are resources कम है जहां, तो I would like to just tell them very honestly that we have missed many trains, but this is a train which we should not miss it. However, along with this answer, I would like to put a very pertinent question also to our both experts, and maybe Dr. Tazeen as well and Dr. Suhail, that someone listening this webinar and for the first time he has introduced to these fascinating terms, if he wants to learn it, what you offer for that person, number one, A, and B is that how that learning is going to affect the practice of someone who is working, for example, in Sahiwal, and he is an orthopedic surgeon or a general surgeon or a physician. So these are two questions, which is I'm just narrating it on behalf of someone who just sent it to me.
Excellent question. Irfan, would you want to take it? Whoever wants to take it first.
जी, Irfan, do you want me to take this question?
Do you want to
Yeah,
take the
please go.
question?
Please go ahead. I'll add something into it. Please go ahead, Dr. Sohail.
Yeah, you can do it. Thank you.
जी, देखिए, जैसे मैंने पहले मेंशन किया
Dr.
कि
Sohail,
टेक्नोलॉजी.
Dr. Sohail, somebody is listening to you very carefully and he is saying that, Dr. Sohail, can you please come in English? So,
Okay,
for that
right.
person, let's
देखिए, I'll try to keep it very simple and straight.
Yeah.
As I said, the doctors in the leading roles, they have now a reason to lead a medical or a health tech team as well. Because if they know the problems, they don't find a solution. The solution is around technology, bridging. For example, I give you one example in medical research. Like you want to find out that why we missed mammograms in the past and why there was false positives of cancer diagnosis or false negatives. Now we can put the unstructured data in ChatGPT, for instance, or similar models, because you know that in new AI, it takes unstructured data as compared to the old AI, which used to take structured data. So we have advantage that we have a natural language processing model which can read unstructured data. You don't have to just put them in databases. They can be just text files. Let the system read it. Let them read all the radiology reports and compare where did we go wrong. By that way, we will learn why did we miss cancer, and there was a several finding which they missed. Now, human eyes can detect 256 scales.
I can't
AI
hear you.
can detect 1024 just sorry, can you hear me? Okay.
Yeah, you lost
So
you for
I,
a
I turn
second.
I turn my video off. I turn my video off, which means that the slightest change in the grayscale, for example, there's a Reed-Sternberg cell. So the slightest change in the grayscale of the nucleus of Reed-Sternberg cell can be picked up by AI generated image detection system. Human eye cannot pick that. Now imagine the benefit
Absolutely.
that now we can go back into data and see why did we miss that cancer? We can save lives, and we need to save them fast. People are dying. We can
Mhm.
save them fast.
Yeah. So,
You can keep
just a
I can keep talking on that. So I just want to stop and
I'm sorry,
give
I
Shiraz.
just want, yeah,
Shiraz
yeah.
has been quiet. I think he's so learned. I want to learn from Shiraz.
We
Maybe
all
let
should
him
be
answer
learning
this.
from Dr. Shiraz. Absolutely. Just a quick
Yeah.
question to Professor Javed. The answer is a doctor sitting in Sahiwal or a healthcare professional. The reason why you should think about using technology and AI-driven systems, A, because you have data. We know AI in healthcare produces data. B, in Pakistan especially, I will just put it out there, we have one doctor for 13,000 patients. Now, when you look at a ratio like that, and when you know that you can have technology that can automate some of your processes, and which means that your need for one a doctor to patient ratio can get better, you should invest your time in learning AI technology so that if you don't want to automate your clinical processes, you can at least automate your administrative processes. And the first step again is to take a course. You don't have to get a degree. And as Irfan said, all the panelists which are here on the webinar today, we all have developed a course specially for this, especially to cater to this population who want to learn AI in simple terms. They're not technology experts. They don't want to learn to code, but they want to learn enough AI so they can make a difference in their clinical settings.
Let me
Dr.
add.
Yes.
Shiraz.
Yeah, Irfan, before you answer, I mean, let me add few words what Dr. Tazeen said. Will you please, for the benefit of our viewers, will tell us the details of that course which Dr. Tazeen is saying?
Is it for Dr. Tazeen? Sorry, I couldn't hear
Yeah,
you.
No, I
Irfan, you
mean,
can take it. You
Irfan,
can
I
take
can.
it. Yeah.
Yeah. Please tell us about the details of the course because,
Okay,
like
I can
me.
give a very high level. I can very high level. Irfan, please chime in wherever you want to. So we've designed the course specially, and because I've been working in this field. What the main challenge I've always felt is we have courses, we have technology which is designed by technologists. This course is designed by health tech experts and clinicians, which means we didn't develop this course in a vacuum. We didn't sit in a room and say, you know what, healthcare has this issue, we will address it. No, we got doctors involved. We studied what the healthcare issues are. I just gave you a few stats about the doctor to patient ratio, the amount of data healthcare makes. We are looking at each and every global statistics out there. And we have designed a course which actually addresses real life problems faced in healthcare today. I think there'll be a shortage of 10 million healthcare workers by 2030. These are WHO statistics, not only in Pakistan. Wherever you are, we are moving very rapidly towards a place where healthcare will have no doctors. We have designed a course which tackles all these real life issues. We will talk from the basics of AI to developing solutions to implementing them. And how as a care team, how as a healthcare worker, you can benefit from these tools. Irfan?
Yeah, so you can let me say this because I'm a technical person. So what I'm seeing, I'm talking out of my experience, honestly speaking, and that is if you're running a practice, you can do it now without AI. It doesn't matter. But let me tell you, you won't be able to do it in next few years. And it will be very hard to adopt the AI when things are on a next level, more complex level. There'll be many people who will be coming beside you with the AI knowledge. This is a right time, absolutely right time. As I said, there are 90% software in the market which are not production ready. They're not absolutely perfect, but they're getting to that stage. There are so many things coming that we can't even imagine. If we just start talking about what is coming, we can take another many hours. We can talk and talk and talk and create that fear. But this is a good time to adopt that. And the biggest challenge I see is that when I was implementing a software in one of our own healthcare sector, in one of our hospital, the main challenge we face is adaptability. Our staff was not able to leverage the AI part. Our staff was hesitant, that as if we are going to replace them. Adaptability is a challenge. If you're going to implement AI in any facility, you need to understand that you have to educate your staff, you have to educate yourself, and do it in a manner that do not make that concept so complex. We are actually making AI so complex that people are so hesitant to start learning about it. And when they're planning to learn about it, they're planning about 2 years degrees. This is a huge gap. So adaptability is a challenge. And let me tell you, this is a right time to adopt AI, grab the basic concepts to handle that challenge that we're going to face in the future.
Absolutely. So that's a very important point. Technology doesn't have to be difficult. You don't have to know maths. You don't have to know computer. You don't have to be a data science engineer. I am nothing of those. So I am just an MBBS doctor, but by working with Irfan and by learning these concepts, today I can say that I understand how AI can work, how it's built, and how it can be implemented in a healthcare setting. I think we only have very few minutes left before we can move on to your questions. And I can see we have a lot of questions. So
Yeah.
I think I want to ask, I would say just maybe 1 or 2 minutes to all my panelists, and I will go to Dr. Shiraz, who has been quiet, is where do you see, what is the future of AI in healthcare?
So essentially, I would also talk about the resistance to adoption because I can relate to it.
Yeah.
So it's because the computer scientist and the medical professional, they lives in silos. How I know that? Because after PhD, I was getting into proteomics and genomics, and boy, oh boy, that was just alien to me. And I can understand that when our doctor friends see the AI, it seems like alien to them. But I can assure you that with a grit of like 1 or 2 weeks or 3 weeks, and with proper passion, you can actually start understanding it. Because if a person like me who does not do biology, but he has put some effort in understanding the basics, and then I was it took me like a quarter or a few months, and I was actually generating research in proteomics, because essentially AI is a tool which will help you solve a problem. And why we want our doctors to actually adopt it? Because if they know the basics of AI, then they will start thinking about in their daily life how they can do any particular task, how they can optimize any particular task using AI. For example, the Pakistani doctors can relate to it. They have to write like a lot of notes, and note writing is a very big part of any doctor who is actually facing the patient. Imagine a system where you are just speaking and it is taking notes, it is creating its summary, it is creating its bullet points, and maybe it is also giving you a prospective diagnosis. Now that is AI. And what you have to do, you just have to understand that there is a technology which exists, which with a very minimal effort can make your life very easy. and that is AI. And the other thing I want to add, respected Dr. Suhail was talking about structured and unstructured data. I just want to make it more easy for our audience. When we talk about the structured data, it's like the data you see in the Excel sheets, which is arranged in rows and columns. But when we talk about the unstructured data, it's the data which is like the written text, which is like the images, which is like the speech we are giving, which is audio signals, which is images. So any data which is not arranged in rows and columns, you can safely consider it unstructured data. And the beauty of current generation of AI is that it is really good at understanding and finding patterns from the unstructured data, which was not possible before. So that is why the AI has a very bright future, because it is here to stay. Like as I mentioned, electricity is here, so AI is also going to be here, and it is only gonna get better and better. It is gonna become a part of your life, and it is the right time you take that difficult step, that difficult leap of faith. And I can assure you, because for me biology was very difficult, so you can relate with me.
Yeah.
Yeah,
So
you
for
can
you,
relate with me.
biology, for you, biology was very difficult, and I can say for me, technology was very difficult. But
Yeah,
here we are together designing a course in AI, which just tells
perfect.
you that you don't really need to be a doctor or a technology expert to take this course or to get benefits from it. I'll quickly go to my all my panelists. Parting words about the future of AI, Professor Javed.
Yeah, I think I would like to request Irfan, if you allow me, that many of our friends are now asking that what is that course you're talking about? Please tell us the specifics about that course and how they can take that course, etc., etc.
Yeah.
So I
So
think
I
this is
think
the
there is
right
a
time.
link. Yeah, this is a very good
Yeah.
question. We have just shared a link in the chat, which will take you to a page which will not only show you the modules of the course, will show you an overview of what you will be getting, what will we teach. It will show you the team. Most of the team that is teaching, who have developed the course, are here in the webinar right now. I will quickly tell you the duration of the course is 2 months. We will have scheduled 2 classes a week. They will be online. You will have 8 modules in total. We will assess the students on the basis of quizzes and assignments. And yes, you will get a certificate, and you will also get course credits. You can look at the course outline in this link. We can come back to this question again. Parting words, Dr. Sahil.
Well, I think आपने सवाल किया कि फ्यूचर क्या है। देखिए, जब कंज्यूमर ड्रिवन को मार्केट होती है तो उसका फ्यूचर बड़ा ऑब्वियस हो जाता है। अगर कंज्यूमर मांग रहा है, अगर पेशेंट ये कह रहा है कि वो डॉक्टर जो एआई का यूज करता है वो बहुत स्पीड से मुझे देखता है, वो मेरे से तवज्जो से बात करता है, उसको नोट्स की फिक्र नहीं है, उसका डायग्नोसिस बहुत क्विक होता है, मैं उसके क्लिनिक पे जा सकता हूँ, बात कर सकता हूँ जब चाहे, वो डॉक्टर ना भी हो। तो जब पेशेंट फोर्स करेगा कि मेरा डॉक्टर जो है उसको एआई का पता है, देन द मार्केट विल शिफ्ट अपसाइड डाउन। जो आज हमें रेजिस्टेंस लग रहा है, अगर आप हिस्ट्री देख लें अप्लायंसेस की, जितने आप अप्लायंसेस देख लें, सबके ऐसे हुआ है। पहले एक रेजिस्टेंस आया, द मोमेंट दैट अप्लायंस कम्स टू हैंड, जब कंज्यूमर ने फोर्स किया, वो चीज पॉपुलर हो गई।
Consumer driven.
और एक मैं बात आपको और कहूंगा कि जब ये डॉक्टर्स को ये डिसएडवांटेज फील होगा कि मेरा पेशेंट एक यंग डॉक्टर को देखने जा रहा है जिसको एआई का पता है और मेरा 20 साल का एक्सपीरियंस है और मेरा पेशेंट जा रहा है मेरे हाथ से, तो देन द पेंडुलम विल शिफ्ट, द पैराडाइम विल शिफ्ट। और ये एक और चीज है कि देखिए, अगर ड्रग डेवलपमेंट एक कंपनी करती है उसको 1 साल लग जाता है एक पॉइंट तक पहुंचते हुए, और अगर वो 24 आवर्स में वहां पहुंचते हैं तो उनको क्या जरूरत है इतनी मेहनत करने की। सो देयर आर सो मेनी थिंग्स, एआई हैज अ फ्यूचर। और एक मैं बात लास्ट करना चाहूंगा, ये बात सबके लिए है कि मल्टी मोडल एआई क्या है कि टेक्स्ट, ऑडियो, वीडियो, इमेजेस एंड व्हाट नॉट, दैट इज ऑल ऑन योर मोबाइल फोन। मोबाइल फोन कैन गिव दिस मल्टी मोडल एआई सिग्नल इनटू अ सिस्टम। हम जितने भी सॉफ्टवेयर बना रहे हैं, मैं खुद एक दो बना रहा हूँ, उसमें मल्टी मोडल इनपुट है सब सिग्नल्स का। अगर आप चैट जीपीटी 4 का वर्जन देख लें, उसमें इमेजेस डाल सकते हैं, लेकिन पहले वो टेक्स्ट भी तो आया था। तो द प्रोग्रेस इज सो फास्ट। कहाँ 1 ट्रिलियन पेजेस 6 महीने में, और कहाँ पहले आप देखिए एआई के जो पेजेस थे चैट जीपीटी में, दे वर ओनली 15 मिलियन, और 1.5 साल में 1 ट्रिलियन हो गए हैं। तो क्या ये प्रोग्रेस नहीं है? फ्यूचर तो है।
Absolutely. So the future is here. The possibilities are endless. And as a lot of our panelists have said, AI is not here to replace us, but it can definitely replace people who don't adopt it in the future. So parting words from Irfan as well, and he can give you a little more insight about the course before we move on to. We've got so many questions to your
This
question.
is, I would, be saying just few words, and that is, this is a right time. Why I am saying this? Because we know what we are developing. People from all over the world coming to us, sharing their ideas, assigning us some huge projects that we are developing. And during the development, I really see that who is going to use them? How many people are going to be replaced? Because we're seeing the results, as Dr. Sohail was talking about the multimodal. So we really understand what is going to happen. And this is the one reason why I say this is the right time to, start learning AI, start implementing AI, start exploring AI.
Absolutely. Thank you so much again to my great guest today. Thank you again for your insight. I think with all four of these, we can talk for hours, but we had a limited time today. We will have more webinars. It's a series of webinar. So I'll start taking a question, but quickly somebody asked me, I think I did not say that in my overview of the course. This course is not only for doctors. This is course for every healthcare worker, healthcare leader, somebody working in the hospital, a pharmacy, a paramedic, drives an ambulance, anybody who wants to make a difference, who wants to use technology to improve what their current challenges are. So I'm going to take questions. It's me. I'm going to take a question from Kanza. And Kanza, you're saying, what is the role of AI in analyzing large sets of data? I think we spoke a lot about data, and the main potential of AI comes in because we are generating so much data. And AI has the capability of analyzing this data, as Dr. Sohail has been saying, in a far greater speed with much more accuracy than a human brain can. So data is definitely the key that is driving this future of AI. Do you want to add something, Dr. Sohail, before I take another
मैं
question?
सिर्फ एक बात कहूंगा कि देखिए अब अगर ईसीजी का आप स्टडी करें, दैट इज वेव फॉर्म, इस तरह फिजियो के जो इलेक्ट्रोमायोग्राफिक फॉर्म्स हैं, तो जो चेंजेस, सटल चेंजेस एआई पे कर सकता है, और फिर जो रिलेशनल चेंजेस हैं कि अगर ये चेंज हो रहा है तो वो कितना चेंज हुआ है, ये हमारी ह्यूमन कैपेबिलिटी नहीं है कि हम एक नई डेफिनेशन बना सकें. So now we are defining new abnormals because now we can define two objects which are moving side by side much better. तो फिजियो में भी जितने भी वेव फॉर्म्स हैं, जितने भी स्टडीज हैं, now we can find more that a patient with paralysis and polio is getting better, with a stroke getting better or not, much earlier than before,
True.
because of the pattern studies between two objects moving
Absolutely.
together.
So another question from Irsa Hussain. Irsa Hussain has a question. Irfan, if you could kindly answer that. She has a question saying that I am in a clinic and I have some issues at my clinic. And if I want to use the help of AI, should I contact a software company or I should develop it myself? What is the best answer? Or what is the best solution for her?
See, this is very important questions. Let me answer, because I'm receiving such questions. So let me answer it in native language. So if you're facing any problem, कोई भी मसला अगर आपको आ रहा है clinical setup के अंदर, you cannot develop a software. You should not develop a software. But you can get that software developed. Problem क्या आता है? Problem ये है कि जब आप किसी कंपनी को अप्रोच करते हो, जब हमें कोई अप्रोच करता है, तो दो तरह के क्लाइंट्स आते हैं. एक कहते हैं कि हमारे लिए एआई का सॉफ्टवेयर बना दें. They talk about sorry, no, it's Zoom. I was asked you to start your video. I am starting my video. All right. So clients are coming to us and saying, we need AI-based software to solve a particular problem. And then we'll be deciding how to solve it. There are certain clients who are coming to us as a software developer and telling us, this is exactly what we want you to solve. Here is the data. This is the specification. You know, with a clear plan, specification, data, and the roadmap, they're coming to us and we are developing the system for them. The cost margin is like 50%. There is a 50% difference. A person who don't know what he's looking for will end up paying like 50% more. The person who exactly know what he's going to get and how we are going to develop that thing for him will be saving a lot of cost and time. But to get that basic knowledge, to develop that basic domain knowledge before going to any software developer, you need to get the basic understanding. You need to preserve your data. Let's say you're going to tell us, you're bringing us on board and saying, hey, develop a software for me, but you don't have the data. You don't have the structured data. We won't be able to help you. You know, we will have to use some other data here and there, but we won't be able to achieve that level of perfection. But if you know the basics of AI, you'll start saving your data, you'll start structuring your data, you'll start implementing minor SOPs in your clinic, in your hospital for the next 5 years, for the next 6 years, for the next 10 years. And by the time you'll be ready and you will have a gold mine for developers to develop a perfect solution for you. At the end of the day, it is developer who, you know, will be developing the software for you, but you need to develop that basic knowledge to save the time to get the perfect solution.
Absolutely. Great answer. I'm going to move to another question, which again is a very important question about the risks around data. So if you can combine these two questions together, the question was, can I make my own app, which Irfan answered. And then Kashif is asking a lot. We all say garbage in, garbage out, right? The AI would give you what you feed it, right? It's an artificial brain. That is why it's so important that you get experts who can actually clean your data, tell you how to use your data, and develop back-end algorithms, systems that are not biased, that are clean, that are not discriminatory, that are inclusive. Hence, it's always important that you get a good team, because if you don't have a good team and you don't have clean data, you're definitely, and if you're really putting garbage in your AI, it will not be giving you any fruitful results. So yes, Kashif, there are risks. And like with any technology, it is beneficial and it's risky. But if we can clean the data, I know the technology is moving very fast. Now we can see many countries developing regulations around the use of AI, patient confidentiality, consent. EU has released a framework for AI implementation. But as we grow, yeah, go ahead, Irfan.
Yeah, Dr. This is the one reason why we have added a module in our course that how to preserve the data, how to use the data, you know, even how to develop your own GPT. People can develop their own GPTs. People can save their knowledge, years of knowledge in the form of the data model, the software. So you're saying very important point. So that's the reason why we have added that part in that training section as well.
I just want to add something to it, Irfan, if I may. I just want to add something. Can you hear me?
Yes, please,
Can you
please,
hear me?
of course. Go ahead.
Yeah.
Yes, I can.
So I'm actually working on a model where I upload some of my medical records on a trust model, and I can delete that
Sorry, you're coming in, Dr. Sahil. You're not very audible. Sorry.
The large language model, the river Thames, so the signal is quite low here. So what I'm saying is that I'm using a model where I can prevent ingestion of the medical data into a folder, which means I can use the large language model power, but I can still delete my data. That is where what we want to make. And I think with Irfan, I will be discussing this model more and more with Shiraz as well, that how can we do that at our systems? And we will actually show a sample of that in the course as well, that you can upload a document and then have the control to delete it. That is what probably the answer to the question is. So you have control on the data. Yeah.
Absolutely. And I've got a very interesting question. After this question, if audience want to raise their hands and ask a question directly, please go ahead. So there's a very good question again, and I think we will be covering that in our course as well, that how is AI changing the world of medical education, and how does it improve the training of healthcare workers? I'll just start with a very brief answer, and all my guests can give their opinions as well. As we say that what data does is, Data gives personalization, meaning if we give our data to AI over a period of time, it can analyze what our needs and our wants are. So I think the most important uh, benefits of AI that we can see in training and education, it can develop personalized training modules and trainings for their users. It can also, obviously, in medical education, we can use um, virtual reality, we can use data-driven other simulations that can aid in training of doctors.
Yeah, if I can
Uh,
add something into it.
Please, please, yes, please.
Yeah, because I'm a humble student of the field of medical education. I did masters in medical education some years back, and I teach that module in College of Physician Surgeon. See, what medical education has now done is nothing new. Our great teachers have been doing all those things, but medical education has provided an evidence for that. We used to say that our medical practice has to be evidence based. Now we are saying that our medical education has to be evidence based too. And this is the area where artificial intelligence can greatly actually help us.
Absolutely.
Because now in medical education, we have got numbers in the form of academic scores, and we have got numbers in the form of various other various other aspects of medical education. And when we have got the numbers, these numbers can be complexly computed and can develop an algorithm which can actually tell us whether small group discussion is more beneficial, or a one-to-one teaching is more beneficial, or a lecture is more beneficial, for example. So this is why I think in medical education and training our nurses, training our paramedics, training our ambulance people, training our doctors, and even the very complex surgical skills also. Medical education, the artificial intelligence has got the same role which it has in the clinical practice.
Absolutely.
And,
Very
and,
well
and
said.
I absolutely second Professor Javed Iqbal. In fact, I did a workshop on virtual patients in Lahore at University of Lahore in March this year. It is a full day workshop where I designed a patient of cardiac ischemia. And then there was no evidence of white coat syndrome. As you know that when a medical student when a patient is being seen by a doctor, the patient's blood pressure sometimes goes high, the pulse goes erratic because there's a white coat syndrome. So with a virtual patient, there is no element of white coat syndrome. And then, as Professor Javed Iqbal said, there is evidence that people retention of knowledge is more if they're doing it one-to-one training after 3 months. So I totally endorse this idea,
True.
and I think I'm all for this. And maybe I can demo those virtual patients in one of the training courses we are designing together.
Absolutely. That's wonderful. So I can see two hands raised. So I'll take the question from Ali. If we can please unmute Ali.
अस्सलाम वालेकुम सर, कैसे हैं आप?
Walaikum salam.
मेरा क्वेश्चन डॉक्टर शिराज से है। सर, मैंने अपनी ग्रेजुएशन में ड्रग डिज़ाइनिंग और कंप्यूटर एडेड डॉकिंग की थी। तो मैंने कोविड के दिनों में अपनी डिग्री की थी, तो उसमें मैंने मार्केट की ड्रग को कंप्यूटेशनल सॉफ्टवेयर की मदद से, टूल और डेटाबेसेस की मदद से प्रिडिक्ट किया था कि नहीं, जो मैं ड्रग डिज़ाइन कर रहा हूँ वो बेहतर है। इसमें मेरा डॉक्टर शिराज से ये क्वेश्चन है, ऑल ओवर द एआई प्रिडिक्शन मॉडल, तो वो प्रिडिक्शन मॉडल टाइम टू टाइम अपने आप को अपडेट किस तरह करेंगे? क्योंकि उनमें तो वो ही मॉडलिंग या कोडिंग या उसमें सिनेरियोज होंगे जो हमने प्रिडिक्ट कर दिए गए होंगे या टूल डेवलपमेंट में प्रिडिक्ट हो चुके होंगे। लेकिन इन फ्यूचर किसी ऐसे सिनेरियो या ऐसे केस को फेस करना पड़ता है कि हमें उस डिजीज को या उस बायोलॉजिकल डाटा को एग्जीक्यूट ही नहीं हमारा मॉडल कर पा रहा, तो फिर हमें क्या जो मसले आएंगे उसको किस तरह अपनी डेली रूटीन में फेस कर सकेंगे? इसके रिलेटेड क्वेश्चन है
जी। थैंक यू सो मच अली। और इसका मैं बड़ा बेसिक सा आंसर दूंगा ऑन ऑन द एक्सपेंस के, बाकी ऑडियंस हमारी जो है वो रिलेट कर सके। So essentially, AI model always work in two phases. One is the training phase in which the AI model is learning, and the other is the inference phase where the AI model is predicting. So Ali, what you were saying that if you have trained a model, then it is doing inference. But periodically, as all AI models have to do, you put the model in the training mode, you show it more data, and you keep on updating it with new protein samples or with whatever the input sequences you have, so that it can understand and keep itself updated. Once it's trained, you again put it in the inference mode and it again starts predicting. I hope it answers the question.
Okay. Thank you very much, Dr. Shiraz. And I can see a question from Ibrar Mustafa, if he's on the call right now as well. And it's a very important question, something that I get asked almost every day is, what are the start points for adoption and learning to implement AI in a clinical practice? What is the best starting point? I ask this from all my guests.
Well, I think it's the right time that either yourself or Irfan should tell us the specifics of the course which we are launching, because in that will be the answer to this question. And many of our viewers are actually asking this, that please tell us what is that course, how they can just start it, and how they can just adopt it.
And also, Dr. Tazeen, I think you start with the answer.
I will start with the answer. Okay, so I'll start with an answer because, again, as I said, I get asked this question every single day. What is the starting point? The starting point of any technology, innovation, implementation, development, design is from a pain point. We know you are in a clinic and you're facing an issue. It's an issue that technology can solve. That is where the starting point is. You should always start with an issue that you know technology can automate. And there are many in a clinical settings. We today, as I just gave only one example of a doctor to patient ratio, we just don't have enough doctors. So always, starting point is always, what is the main problem? What is the main issue? Start with the main issue. Understand the main issue. Understand the stakeholders involved in that main issue. Understand the outcome you want from that main issue. Then you say, this is my problem. This is where I am. This is where I want to be. And now I want to see where can technology take me from here to there. And this is exactly what we will teach you in the course. You are at A, you want to go at B. How can technology take from you from A to B? And not only to B, how can you successfully adopt when you come at B? That is how to train yourself in technology, digital literacy, all of that we will touch in the course. Irfan.
Let me add something interesting. You know, if there is a problem, anyone can see it. Okay, there is a problem. I have to do something about that problem. But thing is, there are certain actions, operations that are happening, which are absolutely normal. They're not problematic. But let's say you're spending 4 hours to do something and you are doing it successfully. It is not a problem until unless you know that AI can do it in 5 minutes. If you know that AI can do it in 5 minutes, all of a sudden that normal scenario is a problem for you because you're wasting more than 3 hours for that in that domain. How would you know that the thing you're doing in 4 hours can be done in 5 minutes? How? Because apparently it is not a problem, but this is a problem actually. To do that, you need the basic knowledge. To do that, you need to understand what AI can really do. What is AI? You need to develop that critical thinking. Then all of a sudden you will start seeing problems everywhere that you can solve. So this is exactly what we have addressed. That there are normal things around you which are not normal. You can save a lot of time. You can add so much efficiency. Look, you can save so much cost. You can, I won't say you can replace your people. I'll say you can make them more productive. So let's not even talk about the problem. Let's talk about the thing which are going to be a problem for you. And you can really solve them now. And no one will come and identify. There are two ways. Either you go to some data scientist, tell them the entire list of operation that you are doing in any setup and say, okay, now tell us to the data scientist, now tell us what we can do about it. There is another factor that we are trying to do, that a doctor should be able to understand, and any healthcare professional should be able to understand where the problem is going to occur, what is going to happen, and how is going to solve it in advance. This is the purpose of the course that we are going to start.
Yeah, absolutely. Unless you know what technology can do, unless
Yeah.
you don't understand what it can do for you, you really can't foresee that how can you improve your day-to-day operations. I've got another question from Aisha Siddiqui. She's saying that she is related to nursing education. Okay, she's saying robots can replace nurses. I think we've touched upon this as well. I really don't think that robots are here to replace any of us anytime in the future. So I wouldn't worry about that. Yeah, so Ibrar Mustafa, I think it's just a comment, Ibrar, that you were a part of a monitoring OTN, which spent billions of dollars, but it's complex, as you said. Yes. Now, the reason why, again, I'll come to the course. Why was it so easy to automate the tourism industry, the travel industry, the banking industry? Because they are complex in their own way, but healthcare is a little more complex. We're dealing with people who are already in pain. Nobody comes to the doctor or to a hospital because they have to go on a holiday or they have to take out money from their account. They come because they are in pain, which means we're already dealing with complex situations and we're dealing with complex scenarios in a clinical settings. So it's very important, if you want to automate, use technology in a healthcare settings, you really need to understand the problems. You really need to understand what's the issue, how we can automate it. And for that, as Irfan said, for you to even think and visualize that, you know what, this may not be a problem right now, but it can get better. You need to know how technology can make it better. And that's what we will tell you in the course. I think we just got 6 more minutes. Should we take any more questions or any parting words from Professor Dr. Shiraz, Irfan? I think Dr. Sahil had to go. He had to go to his clinic.
I think the last session belongs to Dr. Shiraz and Dr. Javed.
Well, there were certain, I was just seeing that some of the questions were popping out, that I'm a homeopathic doctor, I'm a nurse, I'm a dentist. So is it just for MBBS and specialty doctors, or for us as well? So, well, the answer is very simple. If you deal with the patients, then this is for you. So no matter whether you're a homeopathic doctor, whether you're a dentist or a nurse, or even an ambulance driver who is looking after the patient which they receive on their home. So for everyone AI is needed. And if you just let me know, and you may not take it as an exaggeration, AI is for housewives as well.
And they are using it every day. I think they just don't understand it. There's also something, we don't understand how much AI we are using. So
Yes.
To you, Dr. Shiraz.
Yeah, so essentially, if you are dealing with data and you generate data, and there is a lot of data in the medical, then having the basic knowledge of AI will help you organize that data, maybe use that data efficiently, maybe proactively reach your patients, maybe efficiently monitor your operations, increase your practice. So the possibilities are limitless. But how would you understand those possibilities? If you know where the AI can help you, and with that, you need to take that leap of faith, that first step, to make your mind a little bit uncomfortable, and you need to try to understand it. So the first step is always the difficult step.
Great. I need to answer a question, which is a very important question. It's Sam, that what to do to save the data in any clinical setting, hospital, or whatever. See, if you go to any hospital, people are using hospital management systems, different types of hospital management systems. They are storing the data. Just make sure the data that you are storing is in a proper format. It's a structured data. When we are implementing AI in any healthcare sector, we are seeing that the data is not structured. And when we are going to structure the data, we are wasting a lot of the data. So make sure the data that you are storing is structured. And also, it may sound funny to you, but let me tell you, just make sure you have the access to your own data. I have seen systems where people are storing years of data, but they don't have access to the data. Make sure that you have access to the data. You can always import the data. You can always save the data on local database, in any file, on any server, but you have it. Just don't rely on the backups, which are mostly are encrypted form, and when we are trying to decrypt it, we are wasting a lot of data. So one, you have the structured data. Second, you have access to the data.
Very well said. So I think we just have 2 minutes again. Any parting words, Irfan, before we close?
Same thing, that this is the right time to adopt the AI, learn the basics, develop critical thinking, generate more ideas, shake hands with the data scientists out there in the market, and sky is the limit. But the starting point is now.
Absolutely. And sky is definitely the limit. And don't limit yourself with thinking. Again, as Dr. Shiraz said, you don't need to be a doctor, a scientist, a mathematician, or a technologist, or a coder. This course is for everybody. And that is what's the great thing about it. It has been developed by, as you can see, different people with different expertise. It will cover all areas that you can possibly encounter when designing and implementing a technology and AI-driven technologies in the healthcare setting. So the time is now. We're not teaching something that is going to be very difficult. It's very easy. And we've been sharing the training links again. Please take a look at this. You can start enrolling from today. The course starts from the 1st of August. It's for 2 months. It's got 8 modules, and it will be taught by experts from a range of expertise. 5 of us who were here today, and some more who again bring a wealth of experience and knowledge with them. I would like to thank my honorable guests. The webinar would not have been possible without them. Dr. Suhail is not here with us, but I will extend my thank you to Professor Javed Iqbal, to Irfan, and to Dr. Shiraz for taking time out to speak to us today on such an important topic. Again, this is the first webinar in a series of webinars, and I hope to see all of you again in our next webinar and hopefully in our course. Thank you very much.